Dr. Marta Perez, OBGYN here, and on today's episode, we're going to talk about one of my most favorite topics, which is exercise in pregnancy. I'm going to discuss recommendations for exercise and fitness during pregnancy, and at the end of the video, I'm going to discuss my experience with exercise during my pregnancies. Don't forget to hit subscribe, and let's get started. There are tons of misconceptions about pregnancy and wives' tales and inaccurate information out there about pregnancy, but I think exercise gets an undue burden of bad information, especially on the internet. So I want to help clear up for you what are the recommendations and what are some of the cautions about exercise in pregnancy so you can have a happy and healthy pregnancy. The first thing to note is that exercise is safe and recommended in pregnancy. You should definitely do it. You should also listen to your body, and you might have to make some modifications. Let's get more in detail. Exercise and fitness and moving one's body is an absolutely essential part to health and a healthy lifestyle, including in pregnancy. So if you are someone that is participating in exercise and fitness before you are pregnant, you should definitely continue that during your pregnancy. I'll talk about modifications and cautions in a second, but there actually are pretty few, and most people, it's recommended that they exercise during pregnancy. If you're not someone who worked out or exercised outside of pregnancy, pregnancy is actually a great time to start exercising and working out. It's really good for your body and your baby, and it can really help some of the symptoms of discomforts of pregnancy as well. The American College of OBGYN has a committee opinion consensus statement on exercise during pregnancy, and they state that healthy, uncomplicated people in pregnancy should absolutely engage in exercise, both aerobic exercises and resistance/strength training, both before, during, and after pregnancy, while making modifications that might be necessary due to pregnancy. There are really great benefits to exercise in pregnancy. Some of the benefits include people who participate in regular exercise in pregnancy have higher rates of vaginal delivery, lower rates of C-section, lower rates of gestational diabetes, lower rates of hypertensive disorders in pregnancy, and may even have lower rates of preterm birth and low birth weight as well. These are all really good outcomes. There's also some outcomes when it actually comes to labor that suggest that the labor process itself may be shorter or better tolerated in people who continue physical activity throughout their pregnancy. So overall, it makes pregnancy safer and healthier, and can also help the birth experience be safer and healthier and possibly quicker as well. There's a variety of safe kinds of exercises in pregnancy. The overall recommendation for most people is moderate intensity exercise for 20 to 30 minutes most days or all days per week, with a general recommendation of at least 150 minutes per week. And that's the ideal. Exercise can be anything from walking, yoga, strength training, swimming. It can be a lot of different things for different individuals. A common misconception I see is that there is a heart rate parameter or a heart rate limit to exercise in pregnancy, or there are specific limits on how much weight one can lift or lift in a certain way, like above their head or something. Those are actually misconceptions. Those used to be recommendations, but those are not what we recommend anymore. What we recommend is moderate intensity exercise. And instead of going by heart rate or like a specific amount, what we do is go by a scale of perceived exertion. This is the perceived exertion scale.
Okay, this is the Borg Perceived Exertion Scale. This scale is kind of interesting because it's a 15-point scale that starts at 6 and goes to 20. But the recommendation for pregnancy is to stay around the 13 to 14 range, which is somewhat hard. Because these numbers don't make a ton of sense to me, I like explaining it like it is okay to be out of breath, but if someone asks you a question, you should be able to respond with a word or two to answer. You shouldn't be so winded that you can't talk at all, but it's okay if you can't talk in full sentence either because you're moderately hard.
Heat is another thing. External heat sources like hot tubs and saunas and hot yoga are not particularly recommended because there is some data suggesting that high external heat environments can be associated with an increased risk of neural tube defects. It is unlikely that the internal body heat from working out could get high enough to cause one of those risks, but I just tell people, dress in cool clothing. If you're in a very hot environment where you live, maybe limit time of very strenuous outdoor activities and try to do maybe something a little lower impact in the heat or higher impact indoors. But staying hydrated, wearing cooling clothing can help that as well. Another thing is that we're talking about exercise and fitness here. There are some guidelines for people who have occupational, highly repetitive lifting tasks. If that's you in the setting of your occupational work, let your doctor know and you guys can go over that together, and your work may make accommodations if necessary. Other cautions: if you are exercising and everything's going fine, keep going. But if you're experiencing pain, bleeding, contractions, it might be time to either stop and take a rest, or to say, today's not the day, I'm gonna rest and maybe get back to fitness another day. There are some conditions that we actually don't recommend exercise and fitness in pregnancy. They're rare and they're less common, but you should be aware of them. People who have serious problems, either cardiac disease or lung disease, it may not be recommended that they exercise in pregnancy. Similarly, if you have a specific pregnancy complication related to preterm labor, vaginal bleeding, your doctor can tell you what these conditions are, then generally we might not recommend fitness in pregnancy. Now, this is a good opportunity to say that actually bed rest is not recommended for almost any condition in pregnancy. So normal activity should be fine. Bed rest should be almost never used. I'll do a separate video one time about bed rest, but that's a whole different story. Okay, I'm gonna tell you about my personal experiences in my pregnancies with fitness. So exercising and fitness has always been a huge part of my life. I love running. I have done many half marathons and 2 marathons. I love cycling and using the Peloton. I love doing yoga. It's really just an important part of my life for me that I really, really enjoy as a hobby and something that makes me feel like myself. In my first pregnancy, I was starting out pregnancy in an area of pretty high fitness. I had recently trained for a half marathon. I was doing serious programming on the Peloton called Power Zone challenges, and I was actually able to continue those pretty much uninterrupted in the first trimester. For me, I tend to wake up very early in the morning to exercise, and I noticed that my nausea and my feeling of sickness didn't really set in till later in the day, so I was able to do those workouts pretty much without difficulty. I definitely did notice some changes as pregnancy went on. For example, one day, I was probably 22 weeks, and I went out to go for a run, and I just had like the worst pelvic pain. And I only made it like 2 blocks and I had to stop. A week later, I was with my husband and we were going out for a run, and I ran 5 miles and it felt great. I had no pain. I felt wonderful the whole time. So you just have to listen to your body. That's the approach I take. If I don't feel good that day exercising, I either bring the intensity way down to, like walking or yoga, but that doesn't mean I don't try again another day. I didn't have any major complications related to exercise. I did go see a physical therapist to be sure that I had pelvic floor support and strength, because I did notice a little leakage of urine as early as the early 2nd trimester. And by working with a physical therapist to strengthen my pelvic floor and my core as pregnancy went on, that actually stopped. And so that was really a big relief. I can't tell people enough how valuable pregnancy and pelvic physical therapists can be at keeping your body healthy and active during pregnancy. I highly recommend them. I really worked out pretty consistently all through my pregnancy. I did notice that during pregnancy, there are some changes in my body. Like my calves get really sore. And so I definitely incorporate a lot more yoga and stretching into my routine during pregnancy. My second pregnancy, this has been quite different, unfortunately. First of all, I entered pregnancy at a different fitness level than before. Having a baby and like a really busy, crazy schedule between my husband and I, my fitness went from before my first pregnancy to being, 5 or 6 days a week to being closer to like 3 to 5 days per week, which is totally okay with me. Having the highest fitness goals right now isn't a goal for me. Having fun with my family and having a well-balanced life is a priority for me. And whereas fitness and activity still fit in there, they don't fit in as highly as they did before, and I'm okay with that. So I entered pregnancy at a different fitness level. I mean, my running speeds are way slower than they used to be. Definitely my strength has gone down. I can't, lift as much as before, etc. All those things are okay, but man, the first trimester this time was different. It's different when you're parenting and pregnant. I also struggled with a lot of first trimester bleeding and a subchorionic hemorrhage. And so whereas there's no contraindication to working out because of that, it definitely just I didn't want to work out when I was actively bleeding. It just didn't feel right for me. So there were several weeks, I think I only worked out once or not at all. In addition, I got so many viruses from the baby from daycare. They were not COVID, we tested like crazy, but I had like terrible head colds, and exercise can actually help with head colds, but I was just like totally wiped out and exhausted and feeling crappy from being both first trimester and being sick. It was just a lot. My fitness really took a backseat, and that's okay. Since the second trimester started, I've been feeling so much better. I'm back to incorporating exercise, anywhere from 3 to 5 days a week, depending on the week and what we have going on. And I already feel better. Having that first trimester of not feeling well made me feel really like kind of weak and run down. And so I've been choosing to focus a lot on strength and trying to build strength and stability in this pregnancy. I hope this was helpful. Please leave comments below. I love to see people having active and healthy pregnancies, even starting to work out for the first time in pregnancy. I think it can be super empowering. So I hope you're having a wonderful Friday. Don't forget to subscribe so you never miss an episode, and I'll see you next week.